everyone, I hope you guys are having a good day. My name is Diamond, and to start off our video, I'm just going to be introducing you guys to our topic, which is actually diabetes mellitus type 2, as you can see on the board. And the population that's our target is people who are 45 years and older, African Americans, Hispanics, or Native Americans, both adult and children. It can affect all types of people. So to get started, I'm just going to introduce you guys to the different healthcare professionals that are involved in this process. We're going to start with the physician or the doctor, who is a licensed professional who is concerned with promoting, maintaining, or restoring health through the study, diagnosis, prognosis, and treatment of disease, which for us is diabetes type 2. So the physician will come in, talk about the diagnosis with the patient, give them a generalized overview or explanation as to what that would mean for them, and also a little bit of information about the treatment plan. Next, we have our nurse, the RN, who is also certified, licensed, and passed their board test. They are the closest person to the patient. They spend the most time with them, so they will monitor the patient, administer any meds, advocate for them, and also do some patient teaching before any discharges happen. Then we have our endocrinologist, who is also known as a diabetes specialist, who is a medical professional licensed in their work. They are qualified to diagnose, treat disorders of the endocrine glands and hormones. They'll deal with new patients who are diagnosed with diabetes who don't really know how to manage it and need to learn how to. They'll do a blood glucose and a hemoglobin A1C test to test for diabetes. And if it's a pregnant woman, then they might receive a glucose tolerance test to screen for gestational diabetes. A dietitian, they're accredited and certified, and they're an expert on diet and nutrition. They'll bring in foods to the patient that's within their diabetic diet, and foods like that would be rich in nutrients while also still being low in fat and calories. And these patients are going to be eating a lot of fruits, a lot of vegetables, and a lot of whole grains. A pharmacist is also licensed, certified. They are the medication experts who will prepare and dispense the prescriptions and making sure that the medications and the dosages are correct. This will prevent harmful drug interactions and give patients the right information. In a hospital setting, the patient won't really deal with the pharmacist, but once they are out of the hospital, outpatient basis, they will need to order and come pick up their meds, so this will have them interact with the pharmacy. So we're going to start with the first professional, and that will be our doctor, which is Dr. Atanga.
Hi, my name is Dr. Atanga. How are you doing? I hope you are feeling okay. So today we are going to talk about type 2 diabetes and the pathophysiology of it. So after eating a meal, glucose is absorbed directly into the bloodstream and blood glucose levels increases. This rise signals our pancreas to secrete insulin. Insulin helps the glucose to enter into our cells and burn for energy, or it is stored over there. But in people with type 2 diabetes, the body does not produce enough insulin to meet the demands of the body, and the body may have grown resistant to insulin. In this case, we have the blood glucose building up in the patient's blood. This may explain why you experience excessive thirst and hunger, fatigue, frequent urination, and your weight gain in the past 6 months. We normally diagnose type 2 diabetes by performing several tests like the A1C, which gives us an average of your blood glucose over the past 2-3 months, fasting plasma glucose, and your oral glucose tolerance test. All these tests are to measure your blood sugar levels. It is normally treated with oral anti-diabetics, lifestyle changes, insulin, and I have the nurse here to help you know more about type 2 diabetes management. Thank you.
Hello, I'm going to be your nurse today. My name is Natalia. I'm going to go over some education that is very important when dealing with diabetes. First of all, diet and exercise alone can help prevent type 2 diabetes or even treat it. First thing we want to do in the morning when we wake up is take our blood glucose levels with the stick. You want to check that before meals and at bedtime as well. We also want to do an inspection on our feet and make sure we don't have any cuts or abrasions, because with diabetes we get neuropathy, and just means we can't feel our extremities as well. Okay, we also want to manage our stress levels. We don't want to smoke, and we want to follow a meal plan and limit alcohol. Now, there's two things that could happen with diabetes that are very concerning. That's hypoglycemia, and this is going to cause confusion, anxiety, hunger, pale skin, sweating, shakiness, and palpitations. You could treat this by taking a carbohydrate drink or food and eating it, or taking a glucose tablet. Also, you might become hyperglycemic. This is when your blood glucose levels are over 180 mg deciliters, and it usually happens 1 to 2 hours after eating. And you might have a lot of urine, you might be thirsty, hungry, have blurred vision, and a headache. So for that, we want to carry our fast-acting insulin and use that, because we do not want to develop into diabetic ketoacidosis, because that is life-threatening. So basically, we want to keep our BMI under 25. We want to exercise 150 minutes per week, and we want to keep our blood pressure below 120/80. Next, we have our dietitian, who will go over the meal plan.
Hello, I'm Summer. I'm going to be your dietitian. I heard that you recently got diagnosed with type 2 diabetes mellitus, so today I'm just going to be here to talk to you about some of your options and your diet plan and what you can and can't eat. So, a diabetic diet is naturally rich in nutrients and low in fat and calories. Key elements are fruits, vegetables, and whole grains. A diabetic diet is also based on eating 3 meals a day at regular times to help with the use of insulin, either medication insulin or insulin produced naturally by our body. I recommend foods like healthy carbs, fiber-rich foods, heart-healthy fish, and good fats. When shopping, look for vegetables, fruits, nuts, whole grains, legumes like beans, low-fat dairy products, salmon, tuna, sardines, avocados, and for oil, canola, olive, and peanut oils are good. Those all fall under the categories that I previously mentioned. And try to avoid any fish high in mercury, just like king mackerel. You can also help keep your blood glucose in a safe level range by making healthy food choices and tracking your eating habits in something like a food diary. You can use the MyPlate method that was actually made for people who are diabetic. The MyPlate method is half a plate of non-starchy vegetables, a quarter plate of protein like chicken or a lean meat, and the last quarter is a whole grain item. You can also use the MyPlate method to help you with meal prepping, and that can help make mealtime easier. Exercise is a crucial component of diabetes management. It can also improve your blood sugar, manage your weight, reduce risk of heart disease and stroke, and improve your overall well-being. Smoking and alcohol can make it harder to control your diabetes. This leads to higher A1Cs and an increase in insulin resistance. Nicotine also increases the risk of complications that come with diabetes. For women and men both, try to limit your drinks per day. For women and men over the age of 65, 1 drink a day, and for men under the age of 65, 2 drinks a day. And now, if you have any more questions about insulin or medications, I'm going to introduce the pharmacist. Thank you.
Hi, I'm your pharmacist, Diamond. So I've gotten the order that we need metformin, Humalog, and Lantus. So in case you don't know what those are, what they do, I'll give you some information. Metformin, it's an anti-diabetic med, and it treats type 2 diabetes. It's taken about 5 milliliters on average by mouth, usually 1 to 3 times a day with your meals. And you want to increase your fluids as well, unless contraindicated by the doctor. Metformin, it works by helping to restore the body's proper response to insulin that you naturally would produce. It also helps to decrease the amount of sugar that the liver makes. And some side effects would be things like nausea, vomiting, and stomach being upset. Now our injections, insulin Humalog, that's short acting. It covers insulin needs for meals within about 30 minutes, and it helps to improve glycemic control in both adult and children. And with Lantus, the long acting, it's used in adults with type 2 diabetes and children type 1, and it's also designed to keep you steady even when you're not eating any meals, such as in between meals or overnight, and it helps the blood glucose levels to stay consistent. Thank you. I hope we gave you guys enough information, and you are now being discharged.